Hello, everyone. Good morning. Thank you for joining. Just going to give a quick second to give folks a chance to hop on. All right. Well, I think we'll go ahead and get started in the interest of time. I know everybody's got a lot of things going on today, so definitely want to save time as much as possible. Um, Thank you, everyone, for joining. Really appreciate it. Again, I know everyone's time is super, super valuable lately, and we just appreciate you being here. So I just want to, get started today. We first of all want to find out who's joining us. So if you don't mind dropping in the chat your name and the organization and location of where you're joining us from, that would be fantastic. Also, just some basic housekeeping here. If you don't mind making sure that you do keep yourself on mute as much as you can, that will help the experience for everyone. We do have a little bit of a larger group, so it's harder for us to manage everybody on mute, but if you can help us out, that would be great. And last but not least, we do have the chat as well as the Q&A feature where you can leave questions. So feel free to use both of those options. We do have some team members in the room that will be monitoring the chat and the Q&A with me. So feel free to ask those questions and we will try to address them as they come up. If we don't address them right away, it's probably because it's something that we're going to talk about soon. So please don't feel like we're ignoring you. We just know what's coming. Um, so, again, it's a privilege to be here with everyone today. Thank you so much for joining, no matter where you're joining us from. I know that we've got partners from all across the state joining us, and we really appreciate you again taking time out of your busy days to be here. Um, we had an in-person partner summit a couple of weeks ago, which was really great to spend time with folks in person. I know we had some technology hiccups, which caused a little bit of frustration for some folks. So we wanted to hold this virtual summit to make sure that everyone had a great experience. I did want to highlight just a few notes from our director, Chickie Flowers' keynote at the in-person summit a couple of weeks ago. I'm not going to read through the whole thing, but I just wanted to highlight some of the notes that she shared with us. Um, just because I do think they are important and noteworthy, and they do kind of set the stage for today. So we're coming together today at a moment of change. We know that there's a lot of new opportunities, new tools, and new and uncertainty, and we're entering a period of transition within Oregon Health Authority. We've got some leadership changes that are coming in the months ahead, but Chickie did share with us that she believes that, our shared commitment of serving the people of Oregon and improving access to coverage and working together is going to continue, and that we are still well positioned for what comes next. And so, with that, we are very proud to introduce you to Explore Health, which is our new state-based marketplace. Everybody, give it a round of applause for Explore Health. We're all very excited. Um, so Explore Health represents more than just a name or a new look. It represents our new vision for the next generation of Oregon's health insurance marketplace. Our vision is a marketplace that's easier to understand. It's more connected to the people that we serve. It better reflects the people of Oregon. So innovative, community focused, and committed to making health coverage more accessible for everyone who needs it. Just to be clear, OregonHealthcare.gov is not going away. It is going to remain an important destination for folks in Oregon who are seeking information about health coverage. So it's going to still remain a trusted resource. It's Explore Health is just an evolution of our identity and a way for us to communicate who we are and what we offer. But again, as Chickie reminded us, a strong brand is way more than a logo or a website. It's about creating an experience. It's about helping people that we know, helping people know where to turn and feel confident about when they get there. And we know that you, our enrollment partners, are a critical part of that experience. And so no matter how much our technology improves, no matter how many resources we create, no matter what we do on our end, people still need people, and you are those people. You play a critical role as someone who can answer questions, who can understand their situation, someone who can guide them through the decisions and when things feel overwhelming. And we know that this year that's going to be more important than ever. So we know that this transition is a very significant step for Oregon, but we really hope that you'll remain lockstep with us to continue forward and help us as we help Oregonians move forward as well. And so Chicky also reminded us that there are some federal changes ahead that are going to impact the 2027 year, which do include changes of impacting both qualified health plans and Oregon health programs, or I'm sorry, Oregon health plan programs, which are connected to the marketplace, which our very own Katie Button is going to be discussing later. But no matter what changes happen, whether now or in the future, folks are going to have questions. They're going to have concerns. They're going to want to know what does it mean for themselves? What does it mean for them, their families, their communities? How does it impact them? And really, that's why your role is really important because, again, people are going to look for trusted guidance. And I know I'm preaching to the choir here, so I don't want to belabor the point, but we just really appreciate that you all are serving as a trusted guide for all of the people that in your communities, that you are someone that the folks can look to as someone that can provide help and can really separate that uncertainty from action and can help them understand their options and make informed decisions. So we remain committed to make sure that you have the information, the tools, and the support that you need to keep doing the work that you do. And even though we may not be able to control everything that's happening around us, we do control how we can prepare, how we can communicate, and how we can show up for the people who depend on us. And we hope that, again, you'll remain close partners with us in that commitment and in that partnership. So with that, I'm going to go ahead and move forward. We're going to move on to our next section here, which is our state-based marketplace overview. Really excited to share with you some different parts of our state-based marketplace, a little bit of a preview, if you will. We are going to dive into some of the different aspects of the marketplace. Please know that we're not diving into all of the different aspects of the marketplace because we do have, of course, our certification training that you're going to have to take. So we didn't want to give too many things away before you take that training. We don't want it to be a total bore. But we did want to highlight some of the things that we know that you're interested about. And then after we do this portion of the presentation, we will have some time for Q&A before we go to lunch. And then we'll come back and Katie will give us an update on what's going on and what we should look forward to for open enrollment. So before I hand it off to Victor to jump into the actual system experience, I wanted to talk a bit about the consumer journey and what the start to finish experience looks like. So right now, there's a little bit of a fragmented experience because the federal system, as you may or may not know, the federal system doesn't talk very well with the state system, to put it mildly. So when you go to, for example, when you go to our window shopping tool on OregonHealthcare.gov or our Find Local Help tool, those are completely independent from healthcare.gov. So our tool has some features that healthcare.gov doesn't have. Our tool is updated at different intervals and different frequencies and things. So the information doesn't always match. It's not always the greatest. Alongside that, when you go to healthcare.gov, you may be found potentially eligible for an OHP program that you're not actually eligible for, or they might say that you're not eligible for an OHP program and you might actually qualify. So there's a lot of kind of nuances to the systems back and forth that aren't super great, which is one of the reasons why we're super excited to be moving to a state system so that we can make sure that those transitions and those communications between all of the different systems are very much smoother. So they're not going to be entirely ironed out. I'm not going to sugarcoat it and make it sound like it's going to be perfect. We still are going to have two separate systems. So when you come into the initial plan guide, which is our new plan comparison tool, the system will be built with all of the Oregon specific eligibility guidelines, which means if you are found potentially eligible for an OHP program in the plan guide, it is going to be much more accurate than it would have been before. Also, if you are found potentially eligible for a marketplace plan, or excuse me, an Explore Health plan, and any financial help, and you find a plan that you like, you can actually choose that plan and add it to your shopping cart. And then if you decide to go through the application at that point, it will carry forward that plan choice with you through the application process. So when you get to the end of your application, it will remember what plan you chose. So you don't have to go back through your plan choices and figure it all out again. The other thing I want to mention is that our Help Explorer, which is our new Find Local Help tool, is going to be very specific to the marketplace. So our current Find Local Help tool is going away. It is being replaced with our new Help Explorer is what we're calling it. And that tool is very specific for marketplace because when consumers are able to search for an enrollment partner, they are also able to request that that partner is assigned to their application. So in other words, if they find an assister or an insurance agent that they want to work with, they can actually request that that person is their partner. So they would get, and we'll talk more about this in a few, but basically they can click on a button and then a request gets sent to that partner for approval or denial. So they're much more in sync. They're much more talking to each other much closer. So that's definitely great. The Explore Health application system is still going to determine if someone is potentially eligible for OHP programs. Again, because it is an Oregon, based system and it's based with all of the Oregon rules. All of the eligibility that folks receive is going to be much more accurate. We're able to put in all those nuances for all the different programs that we have here in Oregon. So all of the different nuances for like the OHP bridge programs and all the different OHP levels and things like that, we're going to be able to put in there. And so if someone is assessed potentially eligible for an OHP program, it's much more likely that they will be eligible. We will send their information over to the one system. And then the one online system will determine their actual eligibility. The reverse is true as well. So if someone applies through one online, through the OHP system, and they are determined not eligible for an OHP program, then they will be referred over to Explore Health. And basically, what will happen at that point is an application will be essentially set up for them in the system. And we would just send them a notice that says, hey, we heard you're not eligible for OHP. We've set up an account for you. This is how you claim it. And when they go in to claim their account, all of their information is going to populate. So they'll be able to go through and make sure their information's up to date, answer any additional lingering questions, and get a response pretty quickly. So the communication between the systems is going to be a lot better. There's some other nuances that Victor and Katie and I are going to talk about here in a few that are going to make things a lot better between the systems. But this is just kind of a high level overview that we wanted to give you. And I hope that you see as we continue to talk about the system in the coming slides, that you'll see how some additional improvements and enhancements will improve the experience as well. So for start to finish experience is going to be a little bit different as well than it is on healthcare.gov. Not tremendously different, so don't worry. You're not going to be learning an entire, we're not sending you out to Egypt to learn an entirely new system. But basically, folks can enter through the plan guide, or they can just jump right in both feet and start an account, whichever works best for them. Of course, we would always recommend going through the plan guide just to make sure that they're starting with the right account, because if they're going to go to OHP eventually anyway, might as well just start over there. It streamlines the process. But if they want to jump into an account, power to them. They can do that. So once they start their account, they're going to complete an application. They can choose to enroll in a health plan if they're eligible. They can enroll in a dental plan. And then the new thing through Explore Health is that they'll be able to pay their binder payment right away. So when they leave your office, they will have been able to pay their binder payment, which will lock in that coverage for the first month, which is amazing. We lose people all the time if that with that first month because they don't get their bill or they just don't pay their binder payment. And that first payment, as you know, is really critical to make sure that folks lock in their coverage and that they're able to then take advantage of any grace periods going forward. So we're really excited to be able to offer this feature for folks to be able to pay that initial premium payment in the system. Again, there's some nuances to how that will work. So, I can't really get into that quite yet because we're still kind of finessing that out with our insurance companies and the system and all of that. But we do want to let you know that that is going to be an option. The other thing I want to let you know is that folks will be able to enroll in a health and dental plan. And then if they have any sort of data matching issues or anything, well, they'll need to submit documents. They'll still be able to do that after they do their enrollment. And then basically we will follow up and verify that they're still eligible so that their enrollment can continue. So you will still be able to finish the process from start to finish with them, even if they don't have like a document readily available. And so that way they can follow back up with you and you can submit that document later on. So we just want to make sure that folks do get that, A to B start to finish, or A to Z, I should say, start to finish experience with you. And that you're not having to set 1,000,005 appointments to help folks. We want to make sure that that's a streamlined experience for you, just as much as it is for them. With that, I am going to, I think we got Victor here? We do. So I'm going to hand it off to Victor. And Victor, I'll be here to support you if you need anything, but otherwise I'll let you take it away to start talking about the system.
Thanks, Amy. Hi, everyone. I'm Victor Garcia, Operations Advisor and Program Liaison for the Marketplace. And just a quick overview of some of the screens, what to expect, some of the processes that are involved. For the next couple of slides, we're going to use the term enrollment partner. So that means both agents and assisters. And place we all start once you've kind of navigated through the system with customers or on your own. Eventually, you'll get to this landing page for sign-in. Everybody sees the same sign-in page, so that's customers, assisters, and agents. And your login credentials essentially determine what you see when you get in. So agents will see the agent portal, assisters will see the assister portal. There's a lot of overlap because the way each group uses the system to engage with customers is pretty similar. But overall, again, each one is sort of tuned more to that role. And then diving a little bit deeper, each enrollment partner can manage their book of business. Book of business we normally associate with agents, but in these terms, it's the same for both assisters and agents. It's essentially the list of people that you are authorized to assist, or that have authorized you to assist them on their accounts. So you can assist the customers with their application and enrollment. And there's a couple of different ways to do that also, which we'll be going through. Managing which customers are assigned to you or which customers have requested your assignment, and uploading documents on their behalf to address things like data matching issues. And that's just an example. There's lots of other nuances to that, but those are sort of the primary things you'll be seeing most of the time. And then the ability to review notices that your customers get as well. For assignment of enrollment partners, this is when the customers would like to assign you to their account. They actually have to initiate that request. And there's ways we'll go through in training that, how you can facilitate that or helping them figure that out. But that is a consumer protection measure more than anything else. So the customers must request that assignment request must start with the customer. And then in order to complete the transaction, you'll have to accept that assignment. So you get a notification that someone has requested your assignment to their account, and you don't have to. So you can always decline is also an option. But that accepting the assignment will complete the transaction and attach you to that customer's account. And then assisting customers through the portal, again, with both portals is very similar or essentially the same. So it's, again, a few different ways to do it. One is just to view that customer's information. So you can just take a quick look, see their any sort of notifications that they have. And in addition, be able to impersonate the customer once you're assigned to them, to do things like complete an application on their behalf. So you don't necessarily, once you've accepted that assignment to their account and are kind of their authorized representative in the system, you'll be able to then do things on their behalf. So that would, again, kind of like the previous slide, submit documents if documents need to be submitted, but also be able to actually go in and, if they're like sitting next to you in the office or on the phone, complete the application on their behalf through the portal, and then switch back to your regular view of your overall account. So I'll just stop there for a second, see if there are any questions. Hopefully this isn't necessarily new information to anyone, but we hopefully set the stage for that. But just wanted to see if there's anything there. And then in terms of assistance, if there's anything beyond what can be done in the portal or any issues you're having, there are a couple of different ways to get some help with that. One is sort of the self-service option of using the ticketing system. You'll be able to access this through the portal. So if there's an issue you have with a particular customer having trouble resolving a DMI, then you can submit a ticket in this way. We'll also have a dedicated phone line for assisters and agents that we'll go over a little bit later. So there's a few different ways to initiate this, but then once a ticket is submitted, either whether you've done it or it's done kind of on your behalf on the phone, you'll be able to track the progress of that ticket. So if there's an issue that needs resolving that kind of is resolved over time, the dashboard will let you take a look at that as you go. And I see a question in the chat. If there are two separate logins for agents and assisters, it's just a single login. So everybody lands at the same page. And then, yeah, if you've gone through the assister training or the agent training, and that's all that's information's been registered, then your login will take you to where you need to go. So it's not two different pages. It would be just one page. And yeah, who you are as an individual determines which of those you'll see when you get in. So hopefully that answered that question.
Looks like we have a question from Sandra.
Oh, yes, Sandra.
Sandra, if you want to come off mute. Oh, maybe you answered her question.
So the community partner, so this is where we're kind of get into the nuances of the differences between the two portals. And again, when we say the word portal, it's what you see when you get in after your login. So through the community partner portal, community partner managers, those kind of that have the role of kind of oversight of that organization, will be able to manage the listings that are in our local help finder. So much like we have now, we'll have a local help finder, and there will be the ability to change certain information in there for your entry in the community partner organization finder. So, and that's, I think, additional office locations, address, the nuances and details we'll be going over in the training. But there again is some self-service options here. So not necessarily everything needs, we don't need to do that change on your behalf. There are certain things you'll be able to do on your own to change your own listings without having to get us involved with that. Always here to help if you need it. But that is, we're at least moving towards trying to give folks the agency to do things on their own that might not take that much time and are sort of quick and easy to do, and just kind of streamline things and make things more efficient where we can. This is one of those items. In terms of managing the assisters under an organization's umbrella, the organization managers can see all the assisters in the organization. They can also see how many applicants they've had overall, the status of certification of the assisters under the umbrella of the organization, and then the associated renewal dates. Again, just a sample of the sorts of things you can see, but it gives a bird's eye view overall of the status of things like applications and assisters and where they're at with those. And in terms of adding new assisters, again, much like the updating the local help finder listings, organization managers have the ability to request to add new assisters. That request includes sort of the us having a record of that certification having taken place to make sure that the assisters are okay to be part of that organization and in the finder tool, that sort of thing. And so again, this is hopefully the idea is to make things a little more efficient and a little quicker. And it's fairly intuitive. The screenshot here is a little bit on the tiny side for the text, but you are able to kind of submit those changes as you go. And again, always available for phone support if you need any extra assistance or help walking through some of these screens, especially at the beginning. I anticipate as we all get used to things, once we get kind of in the swing of things next year, this will all go pretty smooth. And then in the local help finders, sister organizations are listed by organization. So when folks look up like local help in my area, organizations will show up. Once someone selects the organization, they will then be able to see the assisters, the individual assisters that are part of that organization. So that's just a quick overview of what sister organizations can expect to see in terms of management of customers and some of the, again, sort of self-service options that will be available. And in much the same way, insurance agents and agencies will be able to manage their own listings. Just kind of getting ahead of some of the questions. There is a role that will be an agency manager, and even independent agents will be essentially their own manager. So they'll have the ability to agency with, again, agents under that umbrella that would be sort of in the hands of the agency manager. And there are other roles that we'll be covering in training that can help assist with some of these sort of administrative tasks. So nuances there, and again, we'll be covering during training. But again, this is one of those self-service options. If you have a new office location or change an address, that sort of thing, that can be done through the self-management option for our Find Local Help, making sure that you're showing up in the right locations. In terms of managing agents, agency managers can see, and again, much the same way as the assisters, all the agents in the agency, number of clients, their license numbers, certification status. That certification status is certification with the marketplace. So that's specific to marketplace certification, the sort of license standing with Division of Financial Regulation is separate. So I don't think we'll at least upfront be able to have that information, or won't have that information in there. So it's not to say the status of the license as much as it is your certification with the marketplace. But the dashboards are set up so that these things are easily seen at a glance. And in terms of adding new agents, again, much the same way as before, it is a request. So you just walk through, enter the information that goes to us. We'll just confirm that there's a certification in place, marketplace certification for that agent, and then that'll be added to the agency. And in the local help finder, the results turn up individual agents rather than organization level. So it won't necessarily turn up the name of or agency or the agency. It will turn up, again, individual agents. And then the kind of expanded view, I think will show if the agent is part of an agency, or at least the office location that that's associated with where they're at. But there may be, as we go forward, changes that we'll be discussing with Get Insured. So depending on feedback and how folks feel as they're navigating through the system, we'll be working with Get Insured to see what kind of adjustments we can make to make things a little more specific to Oregon. So because this system is in use by a lot of different states, our main thrust was making sure that we can, we'll stand everything up, everything's working properly. And then as we get more feedback saying, hey, we'd really rather see this, and we get a lot of that sort of feedback, we can try to incorporate some of those changes as we go. And then in, again, much the same way as with the assisters, managing the book of business for agency managers can see a list of all the clients assigned to the various agents within the agency in a few different filtered ways. So you can see by agent, that sort of thing. And then if an agent is moving to a different agency or, becoming independent, leaving the agency, there's the ability to easily transfer any accounts or applications that need to be transferred from that agent to other agents within the agency in bulk. So that can be done in a few different ways. And again, like some of the other stuff, we'll be going through this in more detail during the training. So it'll be a little more clear how to walk through some of those things. And I think that's just what the previous slide was alluding to, transferring, uh, any clients from one agent to another, again, within the agency umbrella, is just a few clicks. And that's what it'll call it, is delegation. So it'll guide you through, walking through transferring clients. Again, don't have to do it in bulk, but you can do like a full list of people, so that it's not necessarily have to be one at a time, especially if there's a kind of a larger list of applicants or enrollees that need to be transferred. And agency managers will also have the ability to see the history of the clients that have been assigned to the agents within the agency. And that sort of it's like a log essentially of anytime a customer or a client has been, again, sort of transferred. And I think you can filter, you can search by agent, you can search by, various fields, and again, we'll be going through this in more detail during the training, but this is just, again, try to make things a little easier, streamline, make things a little more efficient. As we all kind of learn more of the tricks and ins and outs of the systems, we'll be expanding what we have in the training in terms of just different ways of making life easier for you in any way that we can with that kind of efficiency. As for managing the books of business, organization managers can see, I think, was this a duplicate slide? Okay. Yeah, I think we might have covered that already, but essentially, you can see everyone under a person's book of business and transfer things in bulk. So yeah, just slide kind of reiterating that. Oh yeah, it was for assisters. Okay. So, and then last, we're landing on this slide. This is what you can expect to see after working with an applicant, and those things have been submitted. When we work with the carriers in the one system, everything is transferred in batches at night. So instead of real time, especially if you have customers or clients that you've been working with and things maybe have changed a couple of times during the application process, a few different options have been selected, rather than generating a new application event or new file transfer every single time a change is made to a completed application. It's just going to be one nightly batch, and whatever the last changes that were made to that application are what goes to that place. For the one system, for example, any account transfers for people that have ended up being assessed as potentially eligible for OHP or related program, that will all go at night. We're working on updates to our policies, procedures, processes, and we'll be covering some of this in training. It'll change things slightly. Overall, we should see a lot more accuracy with the people that are moved over to the one system, and hopefully cut down on some of the paperwork or the sort of volume of different transactions that is seen on the one end of things, to make it easier for them to sort through which ones are new, which ones are duplicates, and not have to sort of deal with that on a daily basis. So the nightly batch transaction just makes things simpler overall, but it may also mean that someone that has been transferred to the one system may need to wait until the following day before contacting the one system so that they'll see that application comes in. So those little nuances will be the sorts of thing we'll be going over during training. But but in much the same way as the FFM. Otherwise, the file transfers are secure. Referral information goes over. We'll be, as time goes forward, we'll also be working with the one system and have been already, for the past couple of years, to continue to streamline these transactions. So if there's any other friction points that come up as a result of these transfers or anything else, we'll be working to smooth those over as we go. Having that actual dialogue is great for the one system too, because they couldn't really talk to the FFM. They just had to receive whatever it was they were getting. So being able to actually have that conversation and work on those over time to make things better for everyone has been a real advantage. So the system will allow for status tracking, and with that dialogue in place, if there are errors that come up or anything that needs to be reconciled between the two systems, we can resolve that much quicker than would have been the case with the FFM. There are some instances where things just take time on the one side of things. So if those things take time, that will still take time. But in terms of just communication between the two entities and any problems resulting from that should all be resolved much more quickly now. And then if we have periods of high volume, so think open enrollment, especially like the last few weeks, or last few days of open enrollment, or right as open enrollment opens up and people are kind of pouring in, the volume of that is tempered a little bit by this nightly batch process. So that will reduce the potential for errors overall. And then during that nightly batch processing, that's also when eligibility notices are sent. So if there are eligibility notices to be sent that need to be, they will be done again during that nightly batch process. So I think that covers just about everything for my side of things. I'll stop there, see if there are any additional questions.
Yeah, we can stop here. If anybody has any questions about this system so far, and I am going to do a little bit of a walkthrough of the system as well here, so folks will have a little bit of a chance to see it. If not, we can hand over to Katie. Oh. All right, Katie, take it away.
Great. Thank you, Amy, so much. Hello, everybody. My name is Katie Orkes. I am the Marketplace Enrollment and Appeals Advisor for Explore Health. Today, I'm going to be going through the slides that cover the Consumer Assistance Center. We're super excited that we will have our own Consumer Assistance Center, which will open October 1st during our soft launch. Through the Consumer Assistance Center, the customer service representatives will be using a dynamic program called Yonix. Yonix will provide the customer service reps with easy to follow scripting workflows that will guide the customer service reps through the calls with greater confidence and consistency. Yonix will also assist the customer service reps to improve efficiency, reducing those escalations, and support higher quality consumer interactions. During the use of Yonix within the program itself, there are what the Consumer Assistance Center is calling red buttons, which highlight any discrepancies for the customer service reps to resolve with consumers when they call in to the call center, such as if they're calling in from a different number than what is listed on the consumer's portal. They'll get a pop-up and say, and it will then lead the customer service rep to ask and to verify their phone number while they're on the call. Additionally, there will be real-time screen pops during the call, which pull data directly from the customer assistance portal, which gives the customer service reps the information they need directly during the call. The overall goal with Yonix is to have a streamlined response, reduce variability, and enhance the overall customer experience across Explore Health. Next slide, please. The Consumer Assistance Center, which I mentioned, will open during soft launch on October 1st. They will be staffed, or it will be staffed by customer service reps from across the US, but will be specifically trained for Oregon specifics and Oregon policies. During open enrollment, the hours will be 8 to 5, Monday through Friday, and open on Saturdays from 8 to 1. Also during open enrollment, there will be extended dates and times. They will be December 13th, 14th, and 15th from 8 to 8, as well well as January 14th and 15th, which will also be from 8 to 8. Of course, those times are all Pacific Standard Times. There's a designated phone line for agents and assisters. That number, as you can see on the slide, is 833 OR plans, 833-677-5267. And then we will continue to use our main consumer phone line. That will stay the same. Next slide. So the IVA is an AI-powered virtual agent capable of natural language conversations. So a caller can say, I went to the doctor and they said I didn't have coverage. The IVA system will pick up on the intent of the call, and that intent for that example is to be enrollment status for the caller, and it will direct those automated responses based on that. It also uses speech to text and text to speech to support the callers who can speak freely without navigating menus, or it allows callers to text directly during the call, such as entering their date of birth. So it'll give the option to either say your date of birth, month, day, year, or you can enter it as a text, and it will recognize either one. Or another example is providing the last 4 of your Social Security number during the authentication process. The IVA will provide curated, standardized responses to ensure accuracy and compliance, which is designed to resolve the top 30% of reoccurring requests through those streamlined flows. All interactions will be recorded and will generate transcripts. This will assist with ongoing training. Additionally, it generates reports from those interactions so we can collect data on the most common calls that we're receiving, and to identify those gaps for additional training for customer service reps. Next slide, please. Our interactive virtual agent is run through a program called AVA. AVA recognizes those natural language conversations. Like I said, and AVA will pick up on the intent of the conversation. AVA will also intelligently route calls to the Oregon Health Plan, Medicare, healthcare.gov, or carriers. During a call, AVA will use secure authentication methods with one-time passwords and verifies user details like data matching issues, open tickets, mailing address issues, and consent preferences. So they will, once the authentication process happens, it'll automatically see if there's any of those issues that need to be resolved with the consumer. For authenticated users, AVA then can perform account tasks at any time of the day, such as password resets, providing enrollment and application status, update contact information for a consumer, and then provide any frequently asked questions to callers as well. And then on the next slide, if all goes well, I believe we will hear a demo.
Okay, I'm going to try this. I don't know if it's going to work, guys, so
Fingers crossed.
Technology.
Perfect. Thank you, Amy. Our Ava will have a little bit different of a voice tone, but overall it will operate in the same fashion. So we can go on to the next slide, please.
Katie, I do want to call
Yeah.
out, we have a question in the chat about what kinds of languages are available for, I'm assuming for Ava.
Right now, the two that I know that we will have are English and Spanish, but all of the customer service reps will offer translation services. Okay, so some highlights of the Ava demo. Ava improves data entry accuracy by moving complex tasks like entering address to SMS instead of relying on spelling over the phone, resulting in fewer errors, faster interactions, and a better customer service. Natural language processing allows Ava to understand conversational statements like I moved to that new rental apartment without menus or keywords. Ava adapts to customer speech patterns, making the experience more intuitive. So Ava's really going to be super awesome once we get that started. Next slide, please. So our high call volume, during normal call volumes, customer service reps will be able to complete full workflows with callers with no delay. During peak times, which is identified as 10 plus callers waiting over 5 minutes, the model shifts to prioritizing access, blocking issues, and encouraging self-service tasks. During the high call volumes, a queue mitigation tool will be used, such as IVR messaging and callback ticket requests, which will help redirect callers to non-peak times or alternative solutions to questions that they might have. The courtesy callback feature will keep the caller's place in line and automatically call them back when a customer service reps become available, when it comes up to their turn that they would have been in line. And then callers will also be able to schedule specific callback times. If they're calling in on their lunch hour and they know they only have like 5 minutes left and they need to be called on a different day, they can schedule those. This option becomes available when wait times exceed 20 minutes or after hours. Next slide. The traditional IVR response serves as only a backup when the AVA system is unavailable. This is the typical kind of phone system. Or when a caller needs routing to a specific resource. The IVR will route callers to customer service reps with matching skills or directly to third-party partners. Some of those third-party partner examples are Agents and the Sisters, healthcare.gov for prior year assistance, Oregon Health Plan for certain households, or carriers for payments and ID card requests or other questions. The IVR also provides additional after-hour self-help options for customers who need support outside of those staff times. Again, this system is only a backup to our IVA or our AVA program. And I believe that concludes my section of the slides. Thank you.
Yeah, thank you so much, Katie. Does anybody have any questions that they would like to ask right now?
That's a good question. I see. How can other English and Spanish speakers request interpretation services on AVA? I don't have that answer right now, but I am going to bring that back to Get Insured and see what that process is going to be. Thank you.
Thank you for that. Also, just want to call out that there was a comment in the chat about the AI voice at the beginning speaking the Spanish segment in an English accent, making it incomprehensible, and if it's going to be fixed. As Katie mentioned earlier, we did test out a number of different voices. And when we chose the voice that we chose, which is not the one that was in the demo, we did try to choose a voice that would work well. And we didn't choose, I don't think we chose the same voice for English and Spanish because we wanted to make sure that the dialect was correct. So I don't believe that will be an issue, but certainly if you have feedback, then we would love to hear it, because that is something that we will be able to change if there is any issue. Linda has a question. Does Ava answer first? And when does Ava answer?
Yes, Ava will be the first to answer all calls, and then it frequently asks during the process if you would like to be transferred to a customer service rep for further help.
Perfect. Any other questions? We'll have more time for questions too if you think of anything. All right. Thank you, Katie. If you don't mind hanging out just in case we have some more questions after I get done with my little part here.
Absolutely.
Thank you. All right, well, I'm going to go ahead and talk about some updates to our website and communications, give you a little bit of sneak peek there, and then I will jump in and show you a little bit of the system in real time. Our new website address is going to be explorehealthor.gov. Please don't go rush out to the internet and type that into your browser, because it won't go anywhere. And I don't want to hear you guys tell me it's not working. It won't be working for a little bit. We're still working on getting the site all ready for you, but I did want to give you a preview of what the website will look like. So this is a screen grab of what we are envisioning for our new homepage. What you will see is that we are really designing this around simple navigation, easy, clear messaging, graphics to help folks with limited English proficiency, imagery that is representative of the communities that we serve. And the graphics that you see here, the images that you see here are images that we have actually taken on of real people here in Oregon in the past. But we actually just wrapped up a photo and video shoot for Explore Health rollout that features actual Oregon families and individuals in their homes and in their environments, which I'm super excited to share with you all. They turned out so well, and I'm just so excited to share. So we will be swapping out these pictures. They will be new and improved pictures, but we just wanted to show you guys a little bit of a sneak peek of what the website will look like. As a reminder, OregonHealthcare.gov is not going away. It is going to get a refresh. I'm also in the process of doing that with some help from some other agency friends. But we will have this new landing page specific for Explore Health. Additionally, I wanted to give you a little bit of a sneak peek on the sitemap for Explore Health's website. When we went through and designed the sitemap, what I did was I thought about all of the different topics that we want to discuss, and try to think about all of the different pathways or the different experiences that people may want to or may be going through as they're using or experiencing their health coverage. So for example, initially when people come to our website, they may be exploring their health coverage options. They might be learning about what health coverage is available to them, what eligibility looks like, what financial assistance looks like, all of that kind of good stuff. So that's all within that exploring section. And then they may move into the shopping section, which moves into our portal and our local help finder. After they shop, of course, they're going to hopefully use their health insurance. So then we move into the using section where they can find resources about accessing care and issue resolution. And then we have sections for maintaining coverage. So information about taxes and payments, like grace payments or grace periods and premium payments. Renewing, so updating your health insurance, reporting changes, qualifying life events, special enrollment periods, all of that kind of stuff. And then, of course, we will have our business section, which will include all of the fun things like all of our policies and our health insurance marketplace advisory committee and reports and rules and all of the fun things. So this is kind of the layout for our new website. Hopefully it feels somewhat intuitive and it'll be easy to navigate for folks. Wanted to make it somewhat logical. I know I've been on websites before where you're kind of like poking around and like not really sure where things are because it just doesn't really seem to follow logic. So definitely didn't want to take that path with our website, and hope that you agree that this follows somewhat of a logical flow. Additionally, as I mentioned before, we will have a brand new and improved Local Help Finder tool. The new Local Help Finder tool is going to have it is going to be a little bit different than the tool that we have before. So the current tool that we have, when you go to the tool, you can search by the type of coverage that you're looking for. So if you need help with marketplace coverage, you just select marketplace, and it will pull up all of the agents and assisters within the radius that you're looking for. Our new tool, when you go to the Local Help Finder, because everyone on the tool is providing marketplace assistance, it's broken out a little bit differently. So you'll be able to search by either insurance agents or assisters. We do have some verbiage down here on the Local Help Finder tool page that does describe the difference between insurance agents and assisters. And I know it's kind of hard to read here on the slide, so I'll just tell you a summary that the biggest difference that we call out is that for insurance agents can provide advice on what plan is best for you. So we do call that out specifically on this page. I will tell you that as well that we recently did some partner testing on our site, and we did get some feedback on the verbiage on this page. So we will likely be doing some updates to the text that's on this page to make it just a little bit more clear on what the difference is between the assistance that insurance agents and assisters can provide. But in general, this is just kind of what, wanted to still show you what the experience looks like. And then Victor showed you kind of what the searching experience looks like. So once you get to, you click on either assister or insurance agent, then that's where you can actually search and find someone near you. Now, if you search for an assister or you search for an insurance agent, and let's say you live in, Southwest Oregon, and there's only one insurance agent within a 50-mile radius, then you're going to have a note that comes up at the bottom of your list that says, you may have additional options if you search for an assister. And so then there will be a link that pops you over to the assister option. And the same is true for the other way. So if you search for an assister and not very many options pull up, then there'll be a statement that says there may be additional options from insurance agents near you, and then it'll switch over to the insurance agent. It'll give you that link option. So just want to let you know that will be available as well. Yeah, we're and we also are looking at some enhancements for the future to see if it makes sense to integrate these two search functions, or what that might look like for the future. So more to come on that, but for at least for year one, this is what we're looking at. Also recognize that this text is quite small, but just wanted to give you an idea about all of the different types of notices that are going to be going out from Explore Health. We've got 3 different groups of folks that will receive notices. We've got our consumers, we've got our enrollment partners, which includes insurance agents and assisters, and then we have employers. Employers won't typically get notices. However, they will get a notice if a consumer reports that they are offered employer-sponsored coverage that is unaffordable. Then we will send a notice to the employer that we did get that report. Enrollment partners, you will receive a notification when you get a new message. There's tons of different notifications. So if there's an update to a ticket, if you have, if someone asks to be your client, if there's an update to a user, there's a ton of different things that you'll get. You can also get, for insurance agents, you can get a daily book of business summary, which will just kind of give you an overview of like what's been going on for that day for your clients. So there's a lot of different notices that you can get. As enrollment partners, you will also have you'll also have access, sorry, I can't talk, to all of the notices that your clients will get. And if you read your notices that your clients get in their secure inbox, it will not mark them as read, so your consumers will still be able to see that they have new notices as well. So that's a really cool feature. So you will be able to pop over to their inbox and see, oh, they got a new notice about, you know, their renewal notice or their enroll. I don't know. I'm trying to look through the list here to see what makes sense. Oh, they got their age out notice, which is a notice that we send out when folks are getting close to 65. Or they got a notice of their SEP was denied or whatever. So you'll be able to see all of those notices. And again, it won't mark them as read. If you look at them, it'll only mark them as read when the consumer actually opens the notice. So the other thing that I want to mention is that we will have options in the system for consumers to select if they want to receive paperless or if they want to still receive notices through the postal service mail. We still do send most notices, even if they get them through the postal service, they'll still be sent electronically. So they'll still show up in their electronic inbox. So you'll still be able to see a copy of them. And if they elect to receive text messages, we often will still send them a text message notification as well. So just wanted to give you a heads up on that. I know notices are always a hot topic, and we did a lot of work to make our notices, the structure and the language very readable. So I just wanted to share a little bit about that with you all as well. So for the general notice structure, all of our notices are going to come in this general format. Of course, if they're printed. If they're not printed, then they'll look like a little bit different. But they'll all have our consistent branding and our consistent color scheme and logo and all of the good things. So you'll know right away that they're coming from us because they'll say Explore Health and they'll have our cool logo in the corner. You'll also always see a barcode in the upper right-hand corner. So if something is returned with a copy of our notice, our system will be able to scan that barcode and sync it up with their account. Also, in our notices, we are eliminating the terminology of Medicaid or CHIP or Basic Health Program or Plan. We are just using Oregon Health Plan or OHP programs rather than the individual program names to avoid any confusion. Since we're not determining the actual eligibility for an OHP program, we didn't want to confuse people by saying, oh, you might qualify for OHP Bridge, and then they get it over to OHP and they're like, oh no, you qualify for this other level of benefit or something, and then they just get totally confused. We're not the subject matter experts when it comes to OHP. We know a lot about it, but we're not going to pretend like we know all. And we're certainly not making that decision. So we're going to just tell folks you might qualify for OHP. We're sending your information over there, and they're going to let you know what you qualify for. And then we've got a lot of tools built into the system to really regulate consistency and automation so that things will again, be very consistent and very regulated. And I'll show you kind of that on here on the next screen. So this just gives you a little bit of an idea for the next steps on our eligibility and renewal section. This right-hand box is actually, most of it is going to be in a lot of our notices. It's what we call our end matter, so it's included at the bottom of a lot of our notices. But the left-hand side is specifically for eligibility and renewal notices. And you'll see there's some things here that are in brackets. Those are code that will be pulled in from the marketplace. So every notice will pull in the same information for those sections. Also on the eligibility notice and the renewal notice, for example, it does pull in the specific plan that they're going to be enrolled in or the specific premium for that individual or their names, all of that kind of stuff. So it's got those placeholders. There's also logic built in. So if the individual, as it's running the notice through the system, if the individual has set up an account, it's not going to include information about how to set up an account. It's going to tell them this is how you log in. If they haven't set up an account, it's going to say, you haven't set up an account, so this is how you do it. So it's going to give them specific information that's tailored to their situation. We also, I hope you notice here that we did put in, tried to put the language in as plain language, easy language as possible so that folks can understand what exactly we're trying to say. We're not trying to talk to doctors and, and lawyers. We're trying to talk to real people throughout our great state. So tried to keep it as easy as possible so that everyone understands exactly what we're trying to say. They don't have to read between the lines. And they know exactly how to get help if they need it. I do want to mention on the notices as well, at the top here, they will typically list if they have an assister or an agent. It will be listed on them as well. Also wanted to give you a little bit of an idea for a tentative consumer notice plan for October. Of course, we do have much more than October that we're going to be sending out notices and communications. We've got a much more broad plan that we're, setting up right now, and we're still in the works. But October is really the big month that we're going to be communicating to folks because that's when Explore Health is really going to start rolling out. We have a pretty firm restriction from our federal partners over at Centers for Medicare and Medicaid Services that we are not able to send any direct communications to our enrollees until CMS actually sends a notice first. So what that means is that CMS is going to be sending a notice. We are hoping that it will land in mailboxes around October 2nd. That notice will essentially say, you are enrolled through healthcare.gov. Oregon is moving away from healthcare.gov into Explore Health, and you will be getting information from them soon. Meanwhile, on October 1st, in the background, our Consumer Assistance Center, our Partner Assistance Center, our website, our platform, all of the things are going to launch, with the exception potentially of our plan guide. We're still kind of in the works on when we can get all of our plan information in there. We're hoping that we can get it launched on the 1st, but we've got that date tentatively slated for the 14th or 15th. So what will happen is the first notices will be sent from CMS. We hope they'll land in mailboxes on October 2nd. We will very quickly follow up with a notice called the account migration notice on around the 5th of October. The account migration notice is sent to every single person who is currently enrolled through through healthcare.gov. We will be migrating them over to the Explore Health system, so they will not need to set up a new account. All of their account information, their application information will migrate over, and we will send them a notice that says, you are currently enrolled through healthcare.gov. Oregon is moving to a new system. We've moved your information over to the new system, and this is how you can access your account with all of your information. We will have a code that they can use to access their account, and they'll need to verify some information, of course, for security. And once they do, they'll be able to log in and see all of their application information. So it should be a fairly easy process. Meanwhile, our insurance agents will be able to access their accounts, and you should have all of your accounts, all of your client accounts matched up with you. So that would be a good time to check all of your client book of business to make sure that you've got everybody listed there. If there's anybody missing, of course, we're going to be happy to help you figure all of that out. We don't have that process worked out yet, so I don't know for sure. Don't know for sure what that process will look like, but we will give you more details as we get closer. We will also begin to send newsletters shortly after we begin sending notices. So we will send general audience newsletters more broadly. And again, we'll start communicating about open enrollment a little bit later in the month. We want to give a little bit of a breathing room between launching Explore Health and letting folks get used to the system and claiming their accounts before we actually start talking about an open enrollment. So we will start really talking about open enrollment around the 20th. And then around the 23rd is when we'll send our renewal notice. So the renewal notice is the notice that will say, we are, we're able to renew you for the next year. This is the plan you're going to be renewed into, blah, 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 blah. And Katie will talk more about that after lunch. But but that notice will go out. It will be separate than the migration notice. It will go out around the 23rd of October. Question from Linda in the chat: can agents let clients know about the change between now and October 1st? So my short answer is no, please do not. This is embargoed information. We are under strict orders to not share information directly with clients until after CMS does. So, yes, sorry. We wish we could too. And then just to give you a little bit of an idea for our campaign map, we are hoping to launch a brand awareness campaign. This says September and October. We're leaning more towards October just for safety of our campaign and our launch. The intention of our brand awareness campaign will be to increase recognition and understanding of Explore Health with the people of Oregon. We want to make sure and build trust and familiarity with the brand before open enrollment launches. This campaign will include coordinated efforts across digital, print, and community channels. And we will be sharing consistent messages about Explore Health, what to expect, what it is, how people can get help, etc. And then open enrollment messaging will start November 1st. Open enrollment will run until January 15th. This may be news to you. We found out on July 6th that open enrollment was going to run until January 15th. So surprise. But we will be running our campaign November 1st to January 15th. We will include all of our typical channels, paid media, so out of home, digital, social, search, print, broadcast. We'll share more with you on that as we get closer. We will have influencer partnerships, some organic social media that we would love for you to share and boost, earned media. And then with all of this, we will also have partner toolkits so that you have plug and play messages that you can share on your social media channels or in your newsletters or your local papers, etc. And then, of course, our outreach team will be continuing to offer community event support both in and outside of open enrollment as well. So with that being said, I do want to say that this year we have some very unique opportunities for collaboration with all of our partners for potentially doing enrollment events or other outreach opportunities. And I know if Misty was here, Misty Rias, our Deputy Director and Outreach Manager, she would be shouting from the rooftops that our outreach team is here to support you. We are happy to partner with you if you're interested in holding an enrollment fair or enrollment event or some other sort of event. So please just let us know as early as possible so that we can see if we have the bandwidth to support. Of course, our outreach team calendars do fill up fairly quickly, so especially during open enrollment. So we want to get you on the calendar as soon as possible. But if you're interested in hosting an enrollment fair, we are happy to support you in both promoting the event and perhaps providing staff to support as well. That being said, that is the end of this portion of our presentation. We do have, I do want to go through a little bit of a run through of the system, a demo, if you will. Before I do that, though, let's answer some questions. Let's see. Oh, Katie, thank you for dropping that information. Okay, so Hannah, clarifying OEP dates. Thank you. So the open enrollment dates are going to be, and Katie Button, I'm stealing your thunder a bit because I know this is in your part, but November 1st to January 15th is open enrollment. With a slight change this year for the first time ever. Well, I don't know if ever, but from anyone who enrolls between November 1st and December 31st will have coverage starting January 1st. And then if they enroll between January 1st and January 15th, they'll have coverage starting February 1st. Technically, I think if they enroll before January 31st, they'd have coverage starting February 1st, but they'd have to have a special enrollment period for the second half of January. Yeah, Katie's shaking her head, so. And we have a slide on that right after first slide of coming back from lunch. So we'll, if you need a visual on that. Any other questions before I hop into the demo, or are folks just excited to see the system? Okay. Well, with that, I can go ahead and pop over here. Let me log in so you guys don't see me typing my password incorrectly. Okay. All right, so apologies, it's going to be a little bit hard for me to navigate the system and see the chat. So work friends, if you don't mind keeping an eye on the chat for me, that would be fantastic. Just let me know if a question comes in or anything. And partners, if you guys have anything specific that you want to see at the system, feel free to drop that in the chat because I'm happy to explore around. We've got about 40 minutes until lunch, so let's just do some exploring together. I'm happy to show you, whatever you want to see. Just keep in mind that this is a test environment, so things are still testy. They're still in flux. So yeah, I'll go ahead and start here with the agent side of things. So in our system, agents will be called agents, not brokers. So just so you know that. I will pop in here to an agency manager so that you can see what an agency manager. So if you log in under an agency manager account, this is what you would see. And you would be able to, your view will actually be a little bit different, but you would be able to see all of the information for your agency, including a history of your individual status. You can see here, this is all of the different information that we have housed in the system. Trying to think. Let me actually just get into a user. No, not user. Sorry. This is me flailing around. I didn't have anything specific planned. Okay, so I'm going to get into an actual user account so that you can see kind of what a user account looks like. So this is Snow White. This is just a test user that I had created a while back. Snow White has already done an application. So this is someone who has already gone through the system, but I can show you a little bit about the application and things. Snow White is working with an enrollment partner by the name of Amelia. So when you come on Snow White's page here, you'll be able to jump in and see things like her applications. So you'll be able to see these are all the different applications that she has. So her current applications and her past applications. You can also see when the application might have been sent to Oregon Health Plan, when there were responses received from Oregon Health Plan. If you click on this eligibility worksheet, it will actually show you the details of the application. So it'll show you, for example, the household income, it'll show you household size, the federal poverty level, so the percentage of the federal poverty level. It'll show you all the different information that went into calculating the financial help, if they're eligible, all of the different ages of the individual family members, if they're eligible individually, all of these things. So all of this information is available to you. You'll also be able to go into the view application summary, which will show you essentially the answers to all of their questions on the application. And then you will be able to go in. I know this is something that we were asked before. You will be able to go in and download that, and you will be able to also print as well. So we were asked that at the in-person summit if there was an option to download or print the application, and the answer is yes. This is also shown at the end of the application, so you can download and print it there as well. When you go into the enrollments, it will show you the enrollments here. These are some buttons that you may not have access to on your end, so so kind of ignore some of this is a little bit different for you. And then when you click view applicant account, it will take you, this is how you would go into the applicant view. So this is what the applicant will see when they log in, and this is what you will see when you log in and you're quote unquote impersonating the applicant. I don't really like to use the word impersonating because you're not really like pretending to be them. It's just that the way that you are able to help your clients is by accessing their account through your portal. So the system knows when it has this orange bar up here, it does know that you're accessing the account through your portal. So it does take record of that. As I mentioned, if you, for example, go in and read a notice, it's not going to mark it as read for the consumer. So everything is tracked depending on the portal that you use to access, like how you log into the account. But you will have view just like your consumer does. So if you're looking at it and you're trying to walk through a process with your consumer, then you're going to be seeing things that your consumer will see. So for example, up here in this corner, your consumer will be able to see who is assigned to them. They can click this button right here, unassign a sister, and they will be able to unassign. So if they decide they don't want to work with Amelia anymore, they can just click unassign. If they want to switch who they're working with, so if they decide they don't want to work with Amelia, but they want to work with a new insurance agent, for example, they can go up here, click unassign, confirm this, and then Amelia doesn't have to do anything. She will just get a notice that she's been unassigned. But then Snow White can go in and request to work with the new insurance agent. So the question in the chat, do we need to have a paper consent form signed, or does the consumer request an agent agreeing to the request take care of the consent form? So no, you do absolutely need to have the consent form signed, and we will have an updated new consent form for Explore Health. We're in the process of finishing that up now. Great question. Let's see, a couple of other things you can see over here. Over here on the left-hand side, you can see there's an inbox. You can also see there's a little envelope up here on the right-hand side where you can access the inbox. When you go to the inbox, you'll be able to pull up all of the different messages or notifications. I can give you a little bit of an idea for what the notice will look like. Again, keep in mind that this is a draft, so it might change a little bit, but it'll at least give you a little bit of a view as far as what things will look like. So here you'll see the assister information will be listed here. If it was an agent, of course, it would say your agent. Go down here, it'll say, thank you for applying for coverage through Explore Health. Here's your eligibility summary. Snow White is eligible to enroll through Explore Health, eligible for premium for financial help, et cetera, et cetera. And then it'll go down, it'll tell them this is the annual income that we use to estimate and your tax household size. And then this is the next step section that we had shown you before. We do remind folks that they have to pay their premium in order for their coverage to start. And then we include information about how to get help and what to do if their eligibility decision is wrong. And then, of course, the privacy disclosure, non-discrimination disclosure, and then we'll have all of the babble, if you will, at the end about how to get help in different languages. So trying to keep it as short and sweet as possible. It's kind of what it will look like. Let me see if the other notices. This is an example of a notice where Explore Health cannot verify some of the information on the account. Trying to see. Sorry for scrolling so quickly. And then this one is an example where someone was found. This will actually, on our notices, say potentially eligible for Oregon Health Plan. So that will be a little bit different on our notices, but that's what that will look like. And then if somebody is determined potentially eligible for Oregon Health Plan, there will be a little blurb here. This is just placeholder language, so our blurb will be different, but it will say something to the effect of, your information has been sent to the Oregon Department of Human Services to decide if you are eligible for Oregon Health Plan. They will let you know as soon as possible. And then we do have a statement at the end that says, if you are found eligible and you're currently enrolled through Explore Health, please come back and cancel your Explore Health plan. So we do want to make sure folks remember to do that. So that's the inbox and the notices. Let's go ahead and jump into an application. Let's see here. Trying to think of how to do this best. I'm just going to click Start Application. Okay, ignore all this. I'm going to skip forward so that we can get into the application. So this is what the application will look like. This is, of course, skipping the identity proofing and all of the things you need to do to start up your application. Folks who have already gone through the healthcare.gov identity proofing will not need to do that through our system because they've already verified they are who they say they are. But anyone who is new to the marketplace world will need to go through identity proofing, which will be a similar system to the healthcare.gov verifying their identity. They will enter their basic information. They will be able to enter a primary contact address. They will be able to enter a mailing address, or they can check the box if it's the same as their home address, a phone number, and then primary contact preferences. So that includes preferred spoken language and written language, and then preferred method of communication for both general communication and then also for the 1095A form. Here is the enrollment help section. So if you are helping someone who has not been assigned to your book of business yet, then first of all, you probably wouldn't be logged in this way. You would just be logged in normally, but they would need to click on this button right here. And then what would happen is you would come to the Find Help page where you would be able to search for, well, you would be able to search for someone. I might not have anybody in this environment. And then they can request you to be assigned to them. If they're doing it on their own, they can select that option, or they can select that they have a friend or family member helping them. If they want to assign an authorized representative, then there is a way that they can do that. I do want to mention that the authorized representative cannot be an assister or an insurance agent. So we want to make sure that you are filling out this section, that you are an enrollment partner, not an authorized representative. I'm not going to run through the entire application, but I do want to just kind of click through so you guys can see some cool things. It's super easy to add and remove people from your account. So if you need to add someone, you just click add household member. If you need to remove someone, you just click remove. So it's pretty easy. I believe if you click remove on somebody that's already on your house, it'll ask why, like, why are you removing them? And it'll ask all the information. So it also helps you determine, these are questions that are also helping to determine, like, for special enrollment periods as well. It asks, I think, in a pretty straightforward way about relationships between family members. Where do people live? So if Dopey doesn't live at the same address, where does Dopey live? And you can enter in Dopey's address. And then it gives you the summary. So after each section, it's going to give you a summary so that you can review all the information. And then the next section is going to go individual by individual. So it's going to have you fill out all of the information for each individual. All of these questions are dynamic. So if you say that you're not a US citizen, then it's going to open up, you know, do you have an eligible immigration status? Yes. What type of immigration status? I have a permanent resident card. Okay, then answer these questions. So it's all very dynamic depending on your situation. If you say, no, your name doesn't match your document, it's going to say, okay, well, what's your name on your document? So all of these questions are very dynamic and dependent on your responses. So we do ask REAL D and SOGI questions. I'll just say that. And we did align these questions as closely to the Oregon Health Plan application as we could, so that we can aggregate data and compare holistically with the Oregon Health Plan system and the overall health systems in Oregon. So these questions should be fairly in line with what you would see on the Oregon Health Plan application. You'll also see, again, the SOGI questions are listed here. So which gender does Snow White most closely identify with? What is Snow White's sexual orientation? All of these questions are entirely optional, but we do encourage folks to answer them because it does help us get a better idea of who we're serving and who we're not serving. So it does help us see who we might be missing out there within our communities and who we need to maybe do some more outreach to, or things like that. We want to make sure that we're not leaving any communities behind. And so this information, of course, is all safe and protected. It's just purely to help us understand health needs across the United States and across Oregon, and how we can better serve the people of our state. So just some additional questions. And then again, it will go through each individual person. I do want to also mention, so once I get through here, let's say I get here and I'm like, oh, I messed up on Dopey. I can click back to Dopey and I can click and then I can click forward. So you can click between, you can't jump ahead, but you can go back and then go back to where you were. So you can't skip, I guess what I'm saying is you can't skip forward. If you haven't seen a screen yet, you can't skip a screen, but you can go back to a previous screen and then jump forward back to where you were. Okay, so these are the tax filing questions. So again, pretty intuitive, I think. Let's see, we've got a couple of questions.
Hey, Amy. Yeah, there was a couple questions. I was just going to point that out to you.
Thank you, Katie. So Hannah, will individuals in Oregon get rerouted to the new website? Yes, healthcare.gov will be sending folks over to us. It's going to be a little bit interesting during open enrollment, because if people are applying for coverage for the rest of 2026 under a special enrollment period, they will still need to go to healthcare.gov. But then if they need coverage for 2027, then they need to come over to us. So that nuance is really important to know. Customers can find an agent and send a request before starting an application, and the agent can accept it and start the application on the agent's account. Yes, you are understanding it correctly. Yep. I have a program that sends emails to set appointments and then sends out consent forms to be e-signed. I was going to run this program next week. Do you know when the consent forms will be available? I do not know for sure, Linda, because we are going through the final stages of review and approvals. So we can see when we can get those ready for you. However, I will say that we are not able to share the branding with our consumers quite this early. So let's connect offline with Michael. Michael, you're in the room too. So let's connect with Michael Wallace and see what we can do to sort that out, that timeline. Thank you, Michael. Cool. Great questions. So tax filing questions. So you can just mark who plans to file income taxes for next year. Yes, they're going to file jointly. Who's the primary tax applicant or tax filer? Who are they going to claim as dependents? So again, pretty straightforward. These are our tribal questions. American Indian, Alaska Native. Again, pretty similar to what you might expect or what you have seen on the healthcare.gov application. So you'll be able to select who the enrolled tribal member or Alaska Native is, member of a federally recognized tribe, and then if so, what state and what name of tribe do they belong to? I'm actually going to select this because it will open up some other things later. So if you respond later in the application, it's going to ask you some questions that are specific to tribal members, right? So it's going to ask you tribal income and things like that. All right. So Medicaid denial. Now it's going to get picky about my dates. Let's see. Let's try this. No, okay, we're just going to do nothing. We'll see what happens. Okay. Is anyone pregnant? No.
Hey, Amy, if you're talking, you're on mute.
I'm sorry, everyone. Work from home life. Okay, I have, so then once you get to the end of the section again, it's going to give you a rundown of all of your answers for that section. And then it's going to move you into the next section, which is the income. So when you go into the income section, again, it's going to move individual by individual. And yes, it's going to show each individual, including the children. You never know if a kid's a child model or something. I don't know. You're going to select their income source. If they have income from tribal income, let's say, you would put it in as other income. Let's just say, we're putting it in, let's just say we're putting it in like this, and it'll show here like this. I do want to mention as well that there is a way that you can say, let's see. There is a way to say the start and stop dates. I don't know why it's not showing up right now. I feel like it usually shows up in this screen, and I apologize that I'm having. Oh, here we go. Okay, so when you put in your income, whether it's daily, weekly, hourly, whatever. So if I say it's like $15 or $16 an hour, whoops, $16 an hour, and I work, let's say, 35 hours a week, do I expect to earn this income for the whole year? No. Let's say I just started my job. I can put in the dates that I start my job or in the dates that I end my job. So if it's for, if I just started my job and I'm planning on working for the rest of the year, then I could put in the end of the year, but put in the date that I start my job. And then it's going to calculate based off of that date. So that should help with some income calculations in the system. So you don't have to do math is the goal. So then here, because I said I was a tribal member and I reported other income, it's going to ask if any of this income is from a tribal source. And so I can say, yes, this income right here is from a tribal source. And so then that way it's counting it correctly. It's going to also ask about deductions. So you can select all of, it's got all these different options for deductions. And then it's going to ask, based on what you entered, this is your estimated income after deductions. If you say no, then you can put in a different amount. If you say, I don't know, then you can say, it's okay, just give us your best guess. We try to be as reassuring as possible. And then it'll give you an income summary for that individual before moving to the next person. So we'll just kind of move along here. Katie, thank you for helping with the question in the chat. Okay. So then once I get to the end, it's going to show me, again, it's going to show me a summary of everything that I put in. So it's going to show me Snow White's income and deductions. Again, you can see tribal income listed here, and then it will also break out the tribal income here. It'll show me each other person's income and deductions. And then we have just our final additional questions. It will run through these questions for each individual. So you do have to answer them for each individual. So we've got our Medicare or other coverage questions, APTC reconciliation questions, questions about if you're offered coverage through a job. So if you are offered coverage through a job, it's going to ask you for this information. And then it's going to ask, does it meet the minimum value standard? And how much the coverage is. We do have a new employer coverage tool that's in the works that will be available to you very shortly as well. We will also have questions about HRA that are offered. It'll ask questions about ICRAs and QSERAs and how much is being contributed and if they're going to be enrolled and all the different things. If they're offered benefits through PEB, which is benefits through the state of Oregon. Again, these are tribal questions and OHP related questions. And then it's going to ask these questions for each person. skip through these. We already kind of saw them. Okay. So now it's going to show you this is your final review screen. So a couple of things I want to call out here. First of all, there's a button up here, so show updated fields. So the cool thing about this is that if you click this, it's going to show you if you're submitting a change to an application, it's going to highlight specifically what you changed. So if you changed any information on the application, it's going to show you exactly what you changed. So you can print out, like, these are the things that we changed on your application today. If you want to print the entire application, you can do that as well. And it will also highlight what changes you made. So it crosses out the old values and it puts in the new things. So those are, that's a pretty cool feature that I recognized and I saw when I was going through the system that I thought was pretty cool. When you get to the sign and submit page, incarceration status, and then all of the typical disclaimers and disclosures that the system typically asks for. We've got our voter registration information here, which of course is not required, but we provide it anyway. Attestations that you're providing correct information, etc. I'm going to sign it because today I'm helping Snow White, and we submit our application. And then you will be able to see how quickly we get a result here. And this is what the result screen looks like. Now, as Victor mentioned earlier, we do have nightly batch processing. So what that means is that you are not going to get an eligibility notice right away. You will see this eligibility summary. So you could print this eligibility summary if you wanted to for your client, if you want to send them home with something. And their eligibility notice will be available in their inbox later that evening. But because we want to make sure that we're not creating eligibility notices if you need to go in and update something. Like, for example, if you're looking at this screen going, $80,000, I don't make $80,000. And then you're looking back going, oh, I put an extra zero or something. You can go in and submit that change and it won't impact what gets sent over to OHP or whatever, because the most recent application at the end of the night is what's going to get sent over to OHP. So, so for that reason, we aren't going to create an eligibility notice until the end of the night, so that we're creating an eligibility notice based on whatever the most recent information is that we've received from the client. So based on all of the information that we've received from the client, they're eligible to shop, they're eligible for premium tax credits, they're eligible for cost sharing reductions. We've got some potential eligibility for OHP in there. And then if you scroll down, we show individual eligibility as well. So we see that Dopey is eligible to shop, but also potentially eligible for OHP. Sleepy is potentially eligible for OHP, et cetera, et cetera. I do want to call out here the action needed. So you can see the action needed is documents required. So you can click that here. It'll take you to this screen where it will list everyone on the left, and on the right, it'll show you what is needed. So you can go in. You will not see this override button, but you'll be able to go in and select what type of document they're going to submit. So if you need to know what types of documents they can submit, it'll show you. But they can select what type of document they're going to submit and then choose and then upload the document. And then for certain types of documents, they'll need to type in information. So for example, income, they're going to type in what income they're providing. And then they can just click through the different people and see what different people need to, what different individuals on the application need to verify. When they first log into their account, they're going to see this page and they're going to say, oh, I need to provide documents. What do I do? Well, right here, there's a little banner that says we need to see documents. So they just click here and it takes them right back to that page. So it's super, super easy to access. They can also go to my eligibility results, and it takes them right back to the eligibility screen, and then they can click here. So super easy. Either way, they can go back to this page and then go confirm event and finish choosing plans. This is showing up a little wonky, so apologies because this is a test environment. But we're going to go ahead and just go to the next screen. Okay, so then we've got our tobacco use screen. We've got the folks who are eligible to shop. So these folks are already enrolled in this plan. So basically it's saying, do you want to keep this plan or do you want to change plans? Let's say we want to change plans. So we're going to say end plan, can't afford the premium. We're going to continue. Let's see. So there, we've ended the plan. That's how easy it is. And then if I want to shop, so for this particular example, Snow White is an American Indian Alaska Native. So we're going to want Snow White to shop separately than Prince Charming. Now we do have options in here to put in providers. We can put in all of the typical things like how many prescriptions you take, how many times you go to the doctor. If there's a prescription that you take, you can put that in to see if it's covered. If there's any additional benefits you want covered, you can put those in. And then it will show you all of the different plan options, and you can compare plans side by side. This is all very similar to the current tool. And I know I'm moving kind of quick because we're running out of time on this section, but lastly, just want to say you can always adjust your premium tax credits here. There's a little slider. You can also type in the amount you want to use. And then to finish your enrollment, you just come here, you put in your attestations, type in your name. Of course, you want to read all the attestations. Don't just agree to things without reading. And then just hit complete. There you go. And then that's what you can do. And then you would just be able to go through and finish for the other folks as well. So that's basically in a nutshell what you're going to see. There's a lot more that goes in that we can show you, tickets and preferences and all the different things. If they want to change their communications preferences, you can go in here. We've got mailing address updates. We've got phone number, email. If they want to change if they're paperless or not, change language preferences, very easy to do. It's very easy for them to see their enrollments. All of this is very very easy to see. They can see the dates that they're ended, the current coverage, all of the things. So yeah, it's all here for them. It's all very laid out very easily, I think. All their past applications. They can see their results. That's their eligibility results. This is another place where they can go into their documents. This is again plan details. And then if they want to see their application summary again, they can go back in here and it'll show all of their answers to their application too. Yeah, Leslie, so to go into the application, what you would do is you would just go in, you'd hit my applications, And then there should be, okay, wait, sorry, I'm floundering here because this is new. Usually, yeah, right here, there's a edit application. And then it just pulls up the application. Sorry, did you catch that? Okay. Sorry, I was floundering there for a minute. I'm still learning the system as well. Um, and then if you have an application, if there's an application started, when you come to the dashboard, it's going to be just right here on the front. So you just go continue application, or you can cancel the application and just kind of start from scratch. But yeah, it's going to be right here on the front page. So that's about it, everyone. That's what I wanted to show you. And then it's really easy to go back and see, go back into your account, and then you're able to see everything right away. Here's, what we just ran through. So it's all right there for you. So that being said, we do have a 30-minute lunch break planned. Wanted to give you guys time to kind of stretch and refresh your brains a little bit. I know Katie's got a lot of really great information to give to you after lunch. So please come back. We've got just a little bit more information to give to you, and it's important to help you prepare for OE. So we're going to gather back at 12:30. And we hope that you will join us again. And we'll see you then. Thanks, everyone. All right, we got folks coming back in, I think. Welcome, welcome. Hello, everyone. All right, I think we've got most everybody here. So I think we can go ahead and get started. Thank you again, everyone, for coming back from lunch. I know that sometimes it can be a little bit challenging after the lunch break, but hopefully you were able to recharge your proverbial batteries at least a little bit. If not, we have the great Katie Button here to share with everyone a little bit of insight of what's coming for open enrollment. So she's got kind of the good and the bad coming for you. So she's going to share it all, and we will have lots of time at the end for questions. So feel free to drop them in the chat, and Katie, you can address them as they come, or we can hold them all for the end, whatever feels best to you. So take it away.
Sounds like a plan. Hi, everybody. For those of you I don't know, I'm Katie Button. I use she, her pronouns. I certify the plans we sell, not on healthcare.gov for much longer. I certify the plans we will be selling on Explore Health. And I also monitor the carriers for compliance with a lot of things, and I help resolve enrollment issues, which hopefully will be less when we move to Explore Health, but definitely for 2026 things that carry into 2027, we'll be working with folks to get those resolved. And if we can move to the next slide, please. So Amy already mentioned this, but I'm just going to mention it again, that open enrollment will be sort of our standard timeline from November 1st through January 15th. But what is different this year is that folks who enroll by 12/31 will have a 1/1 start date. We're going to work with the carriers on kind of some information for folks about what they can expect if they enroll real late in the month, because obviously they won't have, a new card and things like that, but their coverage will still be active and they'll still be able to use it. So we'll put out some sort of best practices on that. But we are really looking forward to having a bit more time for folks to get that 1/1 coverage. And then obviously being able to have our normal sort of open enrollment period will be useful as we transition. Next slide, please. So we have a few eligibility changes for 2027 that I want to highlight. So the first is that folks who are not eligible aliens will still be able to enroll in health plans, but they won't be eligible for tax credits anymore. And so the definition of eligible alien, includes green card holders, lawful permanent residents, citizens of COFA nations, Cuban and Haitian entrants, and mostly excludes people who are refugees and asylees. So if you work with those folks, please make sure that they're aware that they will still be eligible for a full price plan, but they will lose tax credits. Income verification requirements. So this is actually an old slide. And when I made this slide, the income verification requirements were required to be reinstated. It was part of the City of Columbus lawsuit, and so there has been a stay put on that. We don't know if the federal government will appeal that. We are kind of planning some sort of income verification, mostly as a consumer protection, because when folks don't report accurate income, since there are no longer caps on APTC repayment, we don't want people to be liable for the full APTC repayment. So folks should be prepared to provide a pay stub or a 1099 or some other information if their income is a lot different from what they reported to the IRS. If their income is very similar to the IRS, then it shouldn't be a problem for folks. And then the last one is Medicaid work requirements. Those are scheduled to start 1/1/27. And so anybody who is denied eligibility for OHP because they are not meeting those work requirements will not be eligible for tax credits. They can come to the exchange and enroll in a full price plan. Next slide, please.
And I just want to jump in really quick. Sorry, Katie, to say that
No, go ahead.
we have identified, based off of feedback from the in-person summit, that there is some additional opportunities for some training for the Medicaid sides of HR1 changes for our insurance agents especially. So working closely with the HR1 folks on the OHP side of things to see how we can bring that information to you. So more to come. I know we had a lot of questions in person about the work requirements specifically, but more to come on that.
So I think a lot of folks are aware, but in case you're not aware, we have some insurance companies who will not offer plans after the end of the year. So Providence is leaving both the individual and small group markets. They offer medical plans. Pacific Source is leaving the individual market in both medical and dental. They are going to continue offering small group plans. So for those of you who sell small group, that will still be available. And then Dentegra is one of our dental carriers, and they are leaving the individual market. Next slide, please. So we still have statewide, we still have 3 medical carriers, Bridge, Span, Moda, and Regents, and then we have Kaiser, who offers plans in that I-5 corridor. And then for dental, we'll have Dominion, Delta Dental of Oregon, which is also known as ODS, and Humana statewide, and then in the I-5 corridor, Dental Health Services and Kaiser. And Barry, I see your question about green card holders. Folks who are green card holders will still be eligible for tax credits. It's just mostly refugees and asylees who will not be eligible anymore. And the system will ask folks about their immigration status, and we'll be able to correctly identify folks based off of the information they provide. Next slide, please. Sorry, I gotta minimize my other screen. It is, people are having all sorts of emails at me all of a sudden. It's very distracting. So Regents is going to have some network changes for 2027. So they are keeping their individual Connect network, excuse me, but it will only be offered on the standard plans, and that continues to be statewide. And so then they'll have the Icon network that's similar to the individual Connect network that will be available in all the counties except Clackamas, Multnomah, and Washington. They will offer their legacy network, which is now going to be called LHN, and that will be offered in the counties that it has been offered in previously. And then new for 2027, they have a network called PROV, which includes the Providence facilities, and that network is available in Clackamas, Multnomah, and Washington counties. So folks who are Providence enrollees, especially the folks in the Connect network, the PROV network for Regence might be a good fit for them. Next slide, please. And MOTA is also adding a new network. So they're keeping their Select network that's still statewide, that will still be in place. And then they are adding this new network called the Pathways Network for 2027. And that will, again, be available in Clackamas, Multnomah, and Washington County. And that will include Providence facilities. So again, the folks in the Providence Connect plans, that could be a good fit for them. Next slide, please. So when a company leaves a service area and they don't have any plans left, the marketplace chooses a new company and a new plan for those enrollees. And so what we look at first is trying to find a plan that has a similar network. And then we try to look at the benefit structure and make sure that we're crosswalking folks to a plan that has a similar benefit structure. And then we look at price. Enrollees can choose a different plan during open enrollment. We encourage them to go look. But if they don't choose a plan, they'll be auto-enrolled into the plan that we pick for them. I say we will share the crosswalk information in late July. I have currently finished the medical crosswalk and the carriers are looking at it. I've been working on the dental crosswalk today to send to them. We will have a finalized crosswalk next week, but I won't have it available for you all yet just because it's not, it's just in an ugly Excel spreadsheet. So, and I'm going on vacation next week. So when I get back from vacation, I'll work with Amy and we'll make a very nice document for folks to look at. So it will have the discontinued plans and the plans that folks are being crosswalked into. We'll put it on our website so that folks can look at it, but we'll send out to our agents and community partners so you all can look at it. And so I just really encourage you to take a look at those plans and think to yourselves about whether or not those choices are good. I will note that I did not always pick the least expensive plan, and folks weren't always enrolled in the least expensive plan in their area either. So, but prices are going up a lot next year. So please, please, please make sure folks are really looking at premiums, looking at networks, checking their doctor. You know, folks may be willing to move to a plan with a different doctor for, you know, $100 less premium a month. So really want folks to be prepared and aware and not caught by surprise when they're auto-enrolled into a plan with a new carrier that they weren't expecting. Do I have another slide, Amy? I do, that's right. So just a reminder that all bronze plans are HSA eligible. Last summer, kind of late in the summer, legislation was passed that made them all eligible for a health savings account. Prior to that, folks had to be enrolled in what I'm now calling traditional high deductible health plans, which didn't cover anything except preventive services ahead of deductible. So now enrollees in any bronze plan can contribute to an HSA. And so some carriers are still offering those sort of traditional high deductible health plans. I would really encourage folks to look at the other bronze plans because your HSA money will go a lot farther. You know, there's plans out there that have copays for office visits. The standard plans all have $3 $5 office visits. So you can still be contributing to an HSA and taking advantage of those $5 office visits. And a lot of times there are cheaper plans than the, you know, sort of traditional high deductible health plans. So you could be having a premium savings as well as some cost sharing savings there. And I believe that is my last slide. Is that correct, Amy?
That is your last slide. Linda
Yay.
has a, actually Barry has a question and then Linda has a question. So Barry is asking, will it offer Choice Connect and Signature? That was back on the plan network changes.
So those are the Providence networks. Those will all be disconnected. So discontinued. So folks will not have any access to any Providence plans or their networks.
And then
so for Providence facilities outside of the Tri-County area, like Linda is asking, thanks, Amy, some carriers already contract with some of those facilities. There won't be as broad of coverage as the Providence networks had. So if you have folks who are using those facilities who are outside the Tri-County area, really recommend that they use the provider and the facility search and check those out to see if the carriers are offering them. I know that Regence and MOTA are working out some contracting things right now. So if folks were to call right now, they might not have the most updated information, but by the time that we have our window shopping tool up, or excuse me, our plan guide tool on October 15th, there should be updated provider information in there. And so really recommend that folks check their providers and their facilities to see if they're covered.
Thank you.
And regarding the visa holder question, I would need to look into that. I know some visa holders are considered lawfully present and would be under the eligible aliens. Well, all visa holders are lawfully present, excuse me, but some would be considered under the eligible alien status and some would not. And I don't know enough about visa holders to answer that question, but we can look it up and get back to you.
I believe the updated rule is you have to have lawful permanent resident card, a Cuban or Haitian immigrant, or a COPA, be part of the COPA community. So you have to very specifically be in one of those three groups. But yes, we can look up and circle back. Any other questions for Katie? No?
Wonderful. Well, you know where to find me. Feel free to throw more things in the chat and I'll try to answer them. And then obviously, if you have a burning plan question, please reach out and I'm happy to answer questions or take feedback on things that you're seeing at any time. Thank you all.
Thanks, Katie. So now we want to just kind of open it up. We've got time to answer all of the burning questions that you might have about the new system. I know we've got a lot of changes happening this year. So we've got members of our team here. Katie, both of our Katies are here, and Victor and Michael Wallace, our agent and employer liaison, and myself. And Melissa's here too. She's going to talk about training here in a little bit. But does anyone have any questions that we want to cover? Yes, we're going to talk about training here in just a few minutes. Barry, thank you so much. Anybody else? All right. Well, we may just make this a short afternoon after lunch session. What we will do now is we'll move into discussion about training and just some quick reminders. And then I'm happy to give you all some time back for your afternoon. But I am going to go ahead and hand it off to Melissa Hendricks on our team, who is our training coordinator. Melissa, I think I saw that you had jumped on here. Are you
Yep,
ready?
I'm here. Yes, I
Okay,
am.
cool. Thank you.
Hi. Hello, everybody. It's so glad to be able to present some information to you. I'm sure that many of you are wondering about training. I am guessing that there are many folks here that are both agents and assisters. So I'm just going to cover both sections just real quick. On slide, I'm guessing, because I advanced my slides, so I'm hoping that we're on the slide that says about training. Is that right, Amy? Thanks. Sorry about that. There is a rollout timeline. So obviously we started training. We started it last week. We've had 5 sessions so far, and they've been really popular and successful. Lots of feedback that the participants were really happy that they were able to attend the information. Get the information. They asked a lot of questions. We answered most of the questions. There's more questions that we need to answer, and so we're going to make sure that those questions are posted in our newsletters and information, also on our group site, all the places that you could ever want and get information from. Specifically about training, we are offering in-person. That is the preferred method. That allows you the opportunity to ask all those questions and to network and to get feedback from fellow agents and assisters that are in organizations around you. Obviously, there's lots of folks that can't necessarily attend, so we are also offering webinar sessions. They are popular. We opened up some more additional seats this morning, so please, those who were on wait lists should have gotten an email and were added to registration, so you should have gotten an email saying you are registered for the training. If you attempted to enroll or register, I should say, for a webinar and you were told it was full, you might want to try to go back in again today, is basically what I'm trying to say. And the on-demand certification, I know that there are some that are saying, I just want to do it on my own, and I understand, and I get the demands of time. I would encourage you, if at all possible, to first do the training in person. The second option would be webinar. And then the third option is that on-demand option, and that won't be available until August for agents, and it won't be available until September for assisters. And I'm going to tell you that it's a lot of information, and lots of folks are like, oh yeah, I'm really glad I took it in person. I'm sure that people will say, I'm glad I took it in via webinar too, but wished it was in person, just because there's just lots of questions that people have that maybe we don't cover in the training. I don't know, just lots of different things. Yeah. Anybody have any questions? On your screen, you can see a link to where you can register for those trainings, or him.info.training. And I can't see the chat at this moment.
Hannah is asking and verifying that the webinar is live, and that is correct.
Yes.
Leslie is saying she tried the Multnomah and was on a wait list, has not received a notice that they're in, so just did the wait list again. I think what you were referring to with opening more spaces was in the webinar. Is that correct?
Oh, yes. Sorry, didn't make that clear. Yes. So we're a small team. Now, I'm just going to acknowledge this. We're a small team, and I know that lots of people want to get into the different trainings and stuff like that. We are opening up a new training, having said that, in person in Multnomah County. And that is, I'm working it out with somebody from Multnomah County, from an agency, and they said that they were going to open it up to the public. So I'm still getting those details. And each week we learn more, like, oh, we can do another training here, we can do another training there, and stuff like that. We're all slammed in small team and trying to go cover all the different locations throughout the state. So I guess what I'm trying to say is, if you don't see a location, please refer back and see if you can, if there's a new training offered. So check the link frequently to see if a new training is offered. And if you do register for a training and then you find a training that is open and you would prefer to do that, then please make sure that you unregister yourself so that that spot opens up for somebody else. Hopefully that answered your question. So Multnomah County is coming. There's another one in Multnomah County coming in person.
Nicole is asking about an in-person training in Eugene. And I know on the topic of what you were just saying, Melissa, if just throwing out there, if we have any partners that are willing to host a training, then that will definitely help as well. But I don't know if there's any trainings in the works for Eugene.
I think Israel is working on that, but that is one of the other difficulties. Not only are we a small team, but we're having a hard time finding locations to provide these trainings to open up for lots of people, because the offices are busy. So if you are willing to host a location for a training, that would be fantastic. And we encourage you to reach out to me. You can reach me at cp.marketplace@oha.org. Oregon.gov. And I'm guessing Amy just typed that into the chat.
I did.
Thank you so much. Team work. Any other great questions? Love to see you. We have a lot of fun at the trainings. I throw candy at people, not at people, to people. I toss it. We just try to make it fun. It is a long day. We do feed you. Oh, that's a bonus. Come to an in-person training. We feed you. So there you go. And it's good food.
It's true. It's true.
Anything you want to add?
So I can get food.
Anything you want to add, Michael? You were at a training yesterday with agents.
Yeah, no, I think you covered it really well. I mean, we don't actually feed you, but food will be available. I won't actually help with the feeding process, but yes, food will be made available. It's delicious.
Perfect. It's also a great opportunity to just meet the other partners in your area and see what everybody else is doing. And that way, as everybody's getting busy this year, especially with all the changes with the networks that Katie was discussing, folks are going to be slammed with helping folks transition between plans and, carriers and things like that. And so it's going to be good to build up those referral networks and to know who you're referring to and to build those trusted connections. So in-person training is a great way to do that. Awesome. Thank you, Melissa. Really appreciate you providing that information. And like Melissa said, the information on the website here, we do have, when you go to the webpage, there are links to the two different kind of calendars for the assister training and the agent training. So just make sure that you're clicking on the right link, whether you're an assister or an agent. If you are an agent who also has an assister certification with OHP, you only need to do your agent training. The assister certification doesn't really mean anything for us for Marketplace. So just kind of ignore that for us. You just need to do your agent stuff. So just wanted to say that as well. And like Melissa said, we are constantly updating dates and stuff. So yeah.
I just remembered something. Sorry.
Yeah,
I'm like, wait. One incentive for agents. If you attend an in-person or attend an virtual training, you will get CEUs, 6 of them, which is pretty good. So that might be another incentive for you agents. If you do the on-demand, we are not allowed to provide or give out CEUs. So I just wanted to say that. I'm glad you said that. So thank you.
That's true. Perfect. All right. Well, with that, we'll move into just our final little bit of information here. So we just wanted to remind you of some things to finish up, just ties up some loose ends here before we head out. So as Melissa mentioned, make sure that you sign up for and complete all of your required annual training. The due date is October 31st, but we can't actually let you into the system until you finish that certification training. So even though it's not due till October 31st, we would recommend getting it done as soon as possible so that we can get you signed in as soon as possible once that soft launch hits in October. Also, we encourage you to sign up for any of our partner newsletters that we have so that you get all of our future updates. We want to make sure that if policies change or processes or if there's system changes or enhancements that you are in the loop for those. So please make sure you're signed up for our newsletters. In addition, you can join our group site. We just launched our group site this week. So it's kind of bare. There's not a lot up there right now, I'll be completely honest, but you can join. You can request to join by visiting explorehealth.groupsite.com. And that will be the place, the main hub for system updates, information. We'll post all our newsletters, resources, all sorts of things there. There. And then review partner resources. After this meeting, I'll be sending out a recording. I'll send out the slide deck. I'll also send out our updated new enrollment partner toolkit. which is always going to be in motion and updated as things change here on our side, policies or procedures, etc. But we will get that out to you as well so that you can review that, and that will also be available on group site. That being said, that's all the information that we had here for you today. So I'm happy to give you back about an hour of time this afternoon. I wasn't sure how long we were going to take, so so I wanted to over schedule in hopes to get you done early. So I'm happy to give you some time back. Thank you again for spending time with us this afternoon. I know your time is very invaluable, and just we're so grateful that you chose to spend time with us, and thank you for everything that you do to help everyone throughout our state with accessing health coverage. So thank you again, and you have a great rest of your day. Bye, everyone.